developing as a comprehensive dentist, when you start diagnosing more, we need better ways to communicate with our patients. And I just felt at one stage in my career that, hey, you know what? As I'm becoming more comprehensive, as I'm diagnosing more, as I'm communicating more verbally with the patient, I'm like, hey, this patient kind of needs something to go home and read, right? Because I can't just tell them everything and expect to remember it. And a lot of the buying decisions, and I hate using that term, but it's true, for someone to want to spend X amount of money with you to look after themselves, even if it's like just biological dentistry. It doesn't have to be aesthetic dentistry. Even if it's just biological dentistry, they need to sometimes just think about it and have some time to consider things over. So then I started to do letters, which I thought were important. So, and the way I used to do it was like, if I have a patient and I want to find out how you did it and how you do it now in terms of at which point do you go for letters and which point is your threshold? Like, do you have a threshold? Like, for example, if today a patient comes in and they just need one crown and a filling, I'm okay with that. Hey, you need a crown, you need a filling, and I can have that chat in the chair, and I'm confident that I've given them a good value and understanding, and they can retain that information and get some degree of consent as well from that. But when it gets to a certain level where it becomes a couple more crowns, changing a little bit more than that, maybe definitely if there's some periodontal surgery involved, when it gets, the layers of complexity get more and more, at that point, I then need a letter. Now, what is your sort of protocol with that? And what do you advise to general dentists? Should they give a letter to every single patient for every single treatment plan? How do you do it?
Well, that's a very interesting question, because you mentioned something that most of the dentists, including myself, feel a little uncomfortable, which is the financial part. Because dentistry is a branch of medicine, right? But most of dentistry is done privately. So if you want to do comprehensive dentistry, either you want it or not, even if you are not making that much profit for the dentist, you have a lot of materials. I mean, the lab bill is usually very high. So the fact that comprehensive dentistry equals very high cost, it does not mean that you are making a lot of money, but you have to face one very important issue, which is we are talking about a large amount of money. So if you are doing, my threshold, to be very direct to your question, is once the patient needs to spend more than $1,000 or $2,000, depends on your own practice, I give them a very comprehensive letter for treatment plan. In this case, make me clear. If it is a single tooth dentistry, less than 1,000, less than 2,000, what we have in our practice is we have some pre-printed sheets where we have a list of treatments, restorations, crown. We just fill it there. We just fill the total. On the back of that sheet, there are some guarantees of the practice policy, some important information, and that's it. But once you go after 1,000 or 2,000, or even if you just think it's a difficult patient, you want some more information, you just go for a comprehensive letter. So my threshold is a financial threshold. And I think it's very important that we as dentists, we should not be making dentistry for money. I think that's the worst motivation that you can have. You will be miserable if you do that. But dentistry is an expensive profession. It's an expensive work. Even if you don't make that much money for yourself, you will still have to charge a lot of patients because of staff, because of equipment, because of lab. I mean, there's a whole lot of issues involved. But you have to be able to deal with that situation. And another very important hint that maybe we'll talk later, which is I never try to sell anything, never. My thing is information. It's never about selling dentistry. It's about providing information with transparency.
Absolutely. And I agree that now I've reached a stage, a bit like you actually, where it is a little bit about a threshold of at what point they're spending above a level that I think actually it is a significant investment into their health, and therefore to have some written information to just make it more professional overall, and the communication being crystal clear is important in that patient journey, I think. So, hey, if you enjoyed this snippet from the Protrusive Dental Podcast, be sure to check out the full episode on www.protrusive.co.uk. It's also available on Apple Podcasts, Google Podcasts, Spotify, Amazon, you name it, it's everywhere. Also on YouTube. So check out the content if you like it. Please share it with a friend. Thank you.